All right, let's talk about something you probably have in your pocket or purse right now, a health app. We're not just talking about step counters, though. We're going to dig into a really crucial question. How do we design these amazing tools so they actually work for everyone, no matter how old they are or what their cultural background is?
Go on. Seriously, take a look at your phone. I bet you have at least one. Maybe it's for tracking workouts or a reminder to take your meds, or maybe it's how you talk to your doctor. These little apps have become a massive part of our lives, right? They promise to put all this healthcare power right in our hands. And there's actually a name for this whole revolution. It's called mHealth. It's a simple idea, but it's so powerful. It's just using our mobile tech, phones, tablets, to help improve public health for everybody. And this field, it is absolutely blowing up. And the potential here is just massive. I mean, the whole promise of mHealth is that you have these vital health tools and all this information with you anytime, anywhere. It's literally in your pocket. It's all about making healthcare convenient, accessible, and empowering. And what these apps can do is just incredible. We're talking about getting your lab results the second they're available, booking appointments without ever making a phone call, looking up reliable medical info, and even managing complicated medication schedules. You see, these aren't just toys. They're becoming absolute lifelines for people. But, and this is a big but, here's the problem. What happens when these lifelines are designed with only one kind of person in mind? What happens when that one-size-fits-all idea just completely misses the mark for huge groups of people? This quote from the research, it really says it all. The very people who could get so much out of mHealth, older adults, are often just an afterthought when it comes to design. The tech is built for someone younger, someone who grew up with this stuff, and it just leaves a lot of people behind. And the problem isn't just about age. It's also deeply, deeply cultural. A symbol or an image that seems totally normal in a Western country might be confusing or even offensive somewhere else. For instance, the source material points out that certain images you see all the time in Western media just wouldn't be appropriate for many Arab people because of Islamic customs. If an app doesn't get that, it's failed before it's even started. So this is the big question, isn't it? It's one thing to point out what's wrong, but how do you actually fix it? How do you build a piece of technology that feels natural, respectful, and genuinely useful to a specific group of people with their own unique needs? Well, that's exactly what a team of researchers in Jordan set out to do. They ran this totally fascinating study to see if they could design an mHealth app specifically for older Arab users. And, maybe more importantly, they wanted to see if that kind of culturally aware design actually made a real difference. So this was their game plan. They came up with a hypothesis that user satisfaction would really depend on 4 key things. First, learning. Basically, how easy is the app to figure out? Second, the screen. Is it easy to read, simple, and nice to look at? Third, app capabilities. Does it actually work well without crashing? And finally, terminology. Is the language clear, accurate, and easy to understand? Okay, so let's see how they took this idea and turned it into a real, working app. This is the fun part, where we move from the research plan to the actual design and code. So what did they actually do? Well, they made some very specific, really smart choices. The language, obviously, was Arabic. The entire app was laid out from right to left. They used colors like blue, green, and black, which hold real cultural and religious significance. The font was a big, easy-to-read, simplified Arabic, and they used icons and symbols that would be instantly familiar to their users. And here you can see what they came up with. See, this isn't just some generic app that they translated. You can really see the thought that went into it. The right-to-left design, the colors, the big, clear buttons, every single piece was built from the ground up for a specific person. This is the million-dollar question, right? They built the app. A group of 85 older adults in Jordan used it for 4 weeks and then gave their feedback. So, was all that extra work worth it? Did it actually make people happier with the app? The answer was a huge, definite yes. The study found a really strong positive connection between all 4 of their design ideas and how satisfied the users were. Their whole culturally aware design wasn't just a nice thought. It was a measurable, proven success. And we are not talking about a tiny little improvement here. Look at this number, 52.5%. That means their design model, those 4 factors we talked about, accounted for more than half of the difference in how happy users were. That is a massive impact.
Now, when they broke it all down, They found that every single one of those factors mattered. The screen design, important. How well the app worked, important. Clear language, also important. But there was one that stood head and shoulders above the rest.
And here it is. The single most important element was learning. More than anything else, making the app feel intuitive and easy to use from the very first tap. That was the key to success. For this group, usability wasn't just a feature. It was the feature.
So, what's the big takeaway here? Why does this one study from Jordan matter to all of us? Well, the lesson is incredibly powerful, and it goes way beyond just this one app or this one culture. It's about a completely different way of thinking about technology. Because at the end of the day, making a great product isn't about cramming in the most features or having the flashiest graphics. It's about empathy. It's about really understanding the needs and the context of the actual human being on the other side of the screen and building something for them. The research from Jordan proves this universal truth. If we want our technology to actually help everyone, to be truly inclusive, we can't just slap a one-size-fits-all solution on it. We have to start with real people, in their real, specific, and wonderful cultural context. And that leaves us with a final question to think about. As you go through your day, just look at the technology you use. Who is it built for? And maybe more importantly, who is it leaving out? What else out there desperately needs a dose of this kind of thoughtful, human-centered redesign?